Hello everyone, I am Dr. Kona Lakshmi, Minimal Access and Bariatric Surgeon, Yashoda Hospitals Hyderabad. As we see, lot of us are struggling with weight gain and trying to lose weight. I may be struggling to lose 5 kgs, someone may be struggling to lose 10 kgs, someone may be struggling to lose 50 kgs. But what should we do? Initially it should be diet and exercise, means it should be switching to a absolutely healthy diet and a regular exercise every day. And in spite of that, if someone is not able to lose weight, then we have to see why we are not losing weight. Is it that because we are not very true to sticking to our diet and not true to doing our exercise regularly, or we are doing some activity which is not contributing to weight loss, or where our weight has become so much that our physically reducing the diet and doing regular exercise is not helping us. Why it's not helping us? Because sometimes once we start gaining weight, the body starts developing a problem what we call metabolic syndrome. That is because the fat we accumulate causes lot of hormonal disturbances within the system and prevents the body's metabolic rate from acting good. So whatever you are eating is not spent properly on day-to-day basis, and then we start accumulating small amount of calories, and this excess calories whatever body saves all gets deposited as fat, and so fat begets fat and keeps on gaining more and more weight, and that causes the metabolic system to become more and more slow, and this all goes to the fat forming a hindrance to the insulin acting properly, what we call the insulin resistance. So when people go beyond a certain weight, it becomes more and more difficult for them to lose that weight, and then the weight causes lot of other metabolic problems like type 2 diabetes, high blood pressure, high cholesterol, or their joints start going bad and that they're not able to do that little activity which they are supposed to do on a day-to-day basis. This is when they should take medical advice. Means when you are so obese and you are not able to lose that weight and your weight is causing other metabolic problems, and when your doctor suggests that you losing weight is very important for these other metabolic problems to come under control, then you should seek medical advice. Usually in medical advice, when you go to a doctor or a specialist who is dealing with this weight loss problem, they will initially see you and decide whether you can still be pushed to doing diet and exercise to lose the weight, or sometimes small amount of medication which can help you for a very short duration of time can be suggested for you to lose that weight. Otherwise, if you are morbidly obese, that is your BMI is more than 40 or your BMI is more than 30 and you have already developed complications of obesity like diabetes, high blood pressure, high cholesterol, which are not responding to the medical treatment, then you would be suggested to undergo bariatric surgery. So bariatric surgery is a surgical process done on the stomach and small intestine, which brings about lot of good changes in the metabolism and reverses whatever bad effects the obesity has done on the metabolism, and that is how people start losing large amounts of weight. When you need to lose beyond 30 kgs of weight and you have other medical problems, then think of bariatric surgery as the best option to lose this weight and get back to the near normal health as early as possible.